to Legends to Leaders, the podcast dedicated to bringing wisdom of perioperative legends with fresh perspectives for the newly promoted directors of perioperative services. Today, we're honored to kick off our journey with a true icon in sterile processing, James Stogner. James will be discussing the proper leadership of a sterile processing department and the pitfalls of the counterfactual. With over 22 years as a consultant in sterile processing and decades of hands-on experience from the decontamination room to the executive suite, James has shaped sterile processing across the nation. He's served as an interim director and consultant for prestigious academic medical centers to small critical access hospitals. A veteran of the U.S. Navy who began his career in emergency care in combat zones, James brings battlefield precision and lifelong dedication to patient safety into every OR that he touches. James, welcome to Legends to Leaders. It's an absolute privilege to have you here sharing your hard-earned wisdom with the next generation of directors of perioperative services.
Well, thank you, sir. It's an honor to be talking to you.
All right, great. James, many new directors struggle with justifying budget increases for sterile processing. Based on your experience, what's the most compelling data points or real-world examples that you've seen that demonstrate how inadequate investment in SPD leads to higher overall liability and litigation costs?
Well, first of all, by not investing in your SPD, one of the biggest hits that you take is decreased efficiency. By investing in the capital, that can lead to increased efficiency in SPD, reducing turnaround time and improving the workflow. Also, it increases the cost investments by increasing liability cost, operational expenses, such as utilities and maintenance. If you were to invest properly in your SPD, you get improved quality, better sterilization processes that can reduce the incidence of surgical site infections, which can be costly and then impact patient satisfaction. It also enhances productivity. By optimizing SPDs can improve productivity and quality of surgical tray output, positively affecting hospital surgical capacity. To find out if the expense is actually what we call is a juice worth the squeeze, we use data-driven decision-making. Utilizing data analytics and dashboards can provide insights into workflow, identifying bottlenecks, and drive continuous improvement.
Thank you, James. So surgical delays due to contaminated instruments or reprocessing can significantly input OR throughput and surgeon satisfaction. What key indicators should new promoted directors of perioperative monitor to catch these operational disruptions early, and what proactive steps have proven most effective in preventing them?
To quantify the hidden costs associated with SSIs, hospital directors can use financial modeling that incorporates data on infection rates, treatment costs, and the impact on patient outcomes. This modeling can help identify the financial burden of SSIs and inform strategies for prevention and cost management.
When sterile processing breakdowns occur, staff in both the OR and SPD often bear the brunt of the stress. How does underinvestment in SPD contribute to lower morale and higher turnover, and what cultural or structural changes have you seen that most effectively rebuild trust?
It's a great question. By investing in your SPD, you can eliminate the stress put on the perioperative department. The constant struggles take a mental toll just as much as a financial toll. An underfunded SPD affects surgeon satisfaction, confidence from the OR staff, and higher turnover from SPD. And that all adds to more staff to a fragile perioperative department. Rebuilding is a time-consuming effort that is needed from all of Periop. The first step is identifying the issues. Is the department understaffed? Is it undereducated? Not the right equipment? Is the leadership able to identify these and take corrective measures to fix these issues?
So, James, if you're a newly promoted director of Periop, and you have a limited budget, financial constraints, and you've got to prioritize training, equipment, technology, staffing. Which one and in which order and why do you make those investments?
Well, the order that I myself find that is the most important is training. Investing in employees' training and development to enhance the skills and efficiency. That'll lead to better patient outcomes and cost savings. The next is equipment, ensuring that the necessary equipment is available and properly maintained to support patient care and treatment. This also helps eliminate bottlenecks that could impair the SPD's ability to process instruments. The next is technology, implementing advanced technology solutions that can improve patient care process and reduce costs, such as electronic health records or telehealth platforms, instrument tracking that's implemented and used properly, and staffing, of course, allocated sufficient staffing resources to meet the demands of patient care ensures that patient needs are met promptly and effectively. These investments can help mitigate financial risks and improve the overall efficiency of the patient care operations.
Sounds like why invest in staffing if you don't have the right training, equipment, and technology as the foundation?
That's correct, sir. One of the biggest issues that I see when I get to a place to do an assessment, the overall consensus is that we need more people. I find that's not true in a lot of cases. The workflow needs to be evaluated first. A complete assessment needs to be done to find out where the issues are and start resolving it from there.
Interesting. And so if I'm a chief nursing officer or chief operating officer and I want that feedback, how do you recommend a director of perioperative services tells that chief operating officer what they need to know?
By doing data driven reports that actually show that, let's say that in your SPD decontam area, you don't have the proper equipment to allow good workflow. That creates a bottleneck. Now, you could put additional staffing in there, but that will not alleviate the fact that you do not have the equipment for the throughput. That's that's actually pretty common in a lot of areas. And investing in the equipment, the maintenance of it, of such, usually comes out to be more financially beneficial than just throwing bodies at a problem.
Right. That's great. Let's turn our attention to how best practices continue to evolve. How can directors ensure that their SPD teams stay compliant without overwhelming the day to day whirlwind of operations? And what common gaps do you see facilities leaving most vulnerable to regulatory fines?
SPD has become increasingly technical over the last several years. Back in the day when SPD was glorified dishwashers, that is no longer the case. By identifying SPD as technical department instead of a cost burden is the first step. The SPD needs to be treated as the professional technicians that they are. SPD techs need to keep improving their knowledge base. The mentality of we've always done it this way can no longer be tolerated.
So if it used to be dishwashers, and now clearly we are professionalizing SPD and bringing them into more organizational leadership, executive style ranks. How do we do so? What are some practical steps that the C suite or newly promoted directors of perioperative services can do to elevate sterile processing in the minds and the budgets of hospital leadership?
That's a great question. The very first thing is training of SPD leadership to conduct audits and assessments. It's the most important first step that you could take. Routine audits conduct systematic examinations of processes, protocols and outcomes to identify areas of improvement and compliance with standards. Operational assessments use observational assessments to evaluate the actual performance of the staff and equipment, alongside record reviews and staff interviews for a comprehensive view of what's going on in the department. The other things that could be used is quality improvement tools that focus on continuous quality improvement, such as competency checklists, training programs, to ensure that staff are adequately trained and understand procedures. Utilize self-assessment tools that align with regulatory standards, such as those used by CMS, Joint Commission surveyors, to evaluate sterilization, high-level disinfection practices. Risk management strategies to identify non-compliance areas through audits, which can help minimize risks of healthcare-associated infections.
So you've brought up training a number of times, and you're suggesting it should be a priority. If we wanted to incorporate your thinking into professional ladders of sterile processing, how would we think about what would be the first step? Tell us about professional ladders in sterile processing departments.
You actually look at sterile processing department. It needs several different stages, several different ladders, so to speak. One of the first ones is an educator assigned specifically for SPD. It is probably one of the most cost-effective means to educate the staff and bring them up to a productivity level that's actually needed. And I also utilize what I call instrument coordinators. By putting career ladders in place, it reduces the amount of turnover from SPD staff. Therefore, it minimizes the need for retraining of personnel, and it brings the skill level of the SPD team. So it brings them to the highest level of productivity.
So that's another way for a sterile processing department to achieve cost savings is by implementing professional ladders, reducing retention. And the first investment, it sounds like, is in the educator.
Yes, very much so. An educator is paramount for the growth of an SPD.
Well, that's terrific. Thank you, James. As we wrap up this conversation on Legends to Leaders, I want to thank James Stogner for his generosity in sharing decades of insight, from building cultures to staff competency to driving instrument accuracy rates to near perfection, reducing surgical site infections, and mentoring countless leaders along the way. Your journey has been a symbol of true leadership in perioperative services, built on experience, accountability, and unrelenting commitment to patient safety. To our listeners, especially those stepping newly into their roles, take these lessons to heart. Invest in sterile processing, specifically the educator role. Invest in ladders in the sterile processing department, and you'll achieve cost savings due to reduction in turnover. James, the legends that, like yourself, that have brought their experience and their wisdom to the newly promoted directors of perioperative services, we're so grateful to you. Thank you again for being one of our inaugural legends.
Thank you, sir. It was a pleasure.
Okay, keep up the great work.